Pearson.
Thank you, Mr President. My question is to the Honourable Bronwyn Taylor, Minister for Mental Health. Have funds been allocated in the budget which are specifically for the treatment and care of people in the community suffering an acute episode of psychosis or another serious mental health presentation, whether it be for the first time or not?
Take it on notice.
Oh, settle down, Walt.
Order. Order. I call the Honourable Walt Secord to order for the first time, and I call the Honourable Bronnie Taylor to order for the first time. She knows better. Minister has the call.
I thank the honourable member very much for his question, and I note his keen interest in mental health as he was a psych nurse for many, many years. So thank you for your question.
Mr. Mark.
In terms of your question about community mental health services and the budget, it's a record spend in mental health in this budget. It's over $2 billion in mental health. It really is something to be extremely proud of. $700 million in infrastructure projects in mental health over the next 4 years. In terms of community programs, we have a myriad of those happening across the state. I understand too, having a history in health myself and the importance of primary care, I know how important those services are. We're doing really, really well in terms of our acute admissions, but we need to look at those community-based services. We do have extensive spending in those as well. And I was recently at St Vincent's Hospital announcing their mental health plan going into the next 4 years. And they're actually going to specialise in looking at having that acute centre for admission within their emergency department, step up, step down beds as well, and that we're announcing another 600 of those step up, step down beds, so that's in answer to your question. I think that is the real secret that's going forward in mental health, and I think your question is so pertinent, because if we can get that acute admission done well, and we make sure we have those supports for people when they go out into the community, that's the way that we're going to get better outcomes, as you yourself would know as a professional in that field. And I think that if we continue with that focus, and we all know that we want to keep people out of hospital, out of the acute setting, and manage them in the community setting, and it's going to be really, really important for their mental health and for their outcomes. So yes, I'm really happy to say we are investing in that and we are spending on that. And for me, as the Minister for Mental Health, that's going to be an absolute priority for me during this next term of government.
Supplementary.
Yes, the Honourable Mark Pearson on a supplementary.
I thank the Minister for her answer, but could the Minister please elucidate on what funding is actually going into the acute treatment and care of mentally ill people who are assessed, but the treatment is to be done in the community, not in a bed in a hospital?
Yes, the Deputy President on a point of order.
My point of order is that's a restatement.
It's a restatement of the previous question with probably a little additional new part to the question. I don't believe it's a supplementary seeking an elucidation of part of the answer given. The supplementary is out of order.